In today's Health Watch, a new cancer report is highlighting the deep link between alcohol and cancer rates. The American Association for Cancer Research says excessive alcohol use may be one factor behind an increase in at least 6 cancers, including breast cancer and colon cancer. Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF, and she joins us now. Good morning.
Good morning.
So there will be a lot of people who will watch this and they'll say, you know, every couple of years they tell me that a glass of wine is good and that helps me live a better life. And now you're saying even any amount of alcohol can lead to cancer in these 6 types of cancers. So what is this link that the American Cancer Society is identifying?
So we are seeing that with excessive alcohol use, so for women that would be 3 or more drinks per day, 7 or more drinks per week. For men, 4 or more drinks per day, 14 or more drinks per week. With excessive alcohol use, we are seeing an increased risk of various cancers: head and neck, esophageal, stomach, liver, colorectal cancer, and for ladies, breast cancer. Some of this is happening through chronic inflammation. We also know that alcohol changes the microbiome, so those are the bacteria that live in your gut, and that can also increase the risk of cancer.
So is there such a thing as a safe amount of alcohol?
There is no, quote, safe amount of alcohol. Other studies have shown that any amount of alcohol consumption can increase your risk of cancer, particularly if you have underlying medical conditions. But look, you know, I'm not sober. I drink just like, you know, I think all of us at this table do.
Not Gayle,
No.
but
I don't, because I'm thinking, does that mean I'm going to live longer than
You know, but I think it's everything in moderation, right?
Yes, yeah.
And we have trade-offs in life, and we take on certain risks because we enjoy them, right?
You hear the headline, though, Celine, and it just sounds so extreme. That there's a connection. It's almost like, is it saying to people you shouldn't drink at all? But you're saying moderation.
If you don't drink, don't start drinking.
Yeah.
And then if you do drink, really try to keep it within moderation.
So where do you come down on the question of whether alcohol should have a warning label a la cigarettes?
Well, so the FDA regulates tobacco. The Department of Justice and the Department of Treasury regulate alcohol. So there are some differences in terms of jurisdiction, what authority they have. There was a law passed in 1988 that allows for the labeling of alcohol with the warning that you can have issues if you're drinking while pregnant, if you drink while driving, but it would require either an amendment to that law or a new law to have the authority to be able to put that kind of warning on alcohol.
Is there anything you can do to prevent cancer? Sometimes it seems so random to me. People get lung cancer who have never smoked, or people get breast cancer who have no history of it in their family. Sometimes it feels so much like the luck of the draw. Is there anything that you can realistically do?
Well, there is sort of a checklist I can give you. So in addition to cutting back on drinking, quitting smoking, so anything that causes smoke, could be smoking tobacco, cannabis, anything that causes smoke is going to increase your risk of lung cancer and other cancers, so quitting or cutting back on smoking. Obesity, we know, is linked to cancer, so losing weight. Exercise also helps in addition to the weight loss. Wearing sunscreen when you're out in the sun. And then finally, the HPV vaccine, human papillomavirus vaccine, is really underutilized, and we're seeing rates of cervical cancer and oral cancer related to HPV go up. We as the U.S. do a really bad job of vaccinating against HPV compared to other high-income countries, and there's a lot of room for improvement here.
All right. Dr. Gounder, thank you very much. Appreciate it.